Hello, Athens. Thanks
Hi.
for having me
Thank
on
you
your
for.
show.
Oh, I love the visuals.
Yeah, my office. I just had to run over by the office. I'm glad I made it here in time. They just put together a few things
Good.
to sort of help me explain what we do here in Modesto.
Now, I was talking about Botox. We have a clip that we're going to be running in about, about 5 minutes or so that I filmed at your office with you actually performing a Botox procedure. So I'm looking forward to seeing that. But right now you have this skull here with
Yes.
all these different numbers on it.
This
What does
is
that mean?
a prop that helps us learn acupuncture and perhaps even explain it to our patients. This has all the points written in Chinese, which is just very interesting. But this is for a very good representative model for facial rejuvenation acupuncture, which ties very well into our cosmetic surgery practice with my wife, Dr. Tammy Wu. And with this model, these are the key acupuncture points in the face. And I have another model that has key acupuncture points in the ear. Using these needles, we are able to create things that are somewhat like a lift or some effects of relaxing muscles.
You're
like
being
with
very
Botox.
modest. Somewhat. You did acupuncture on mine and
Yeah.
all but took away my frown line.
Yeah, I'd like to. Thank you. I think staying modest is key in being a good physician because once we start to think too big on ourselves and our head gets too big, first of all, our hats don't fit. But staying modest is, I think, is a key way of letting nature take its course and getting too big in the head. That's when I think the therapies don't work anymore. So I'd like to stay modest so that my patients continue to get better.
So tell me other things about acupuncture. I kind of interrupted you there,
Oh.
but not only is it for like a facelift, which is what you did for me, but also for pain. When you put in the acupuncture needles here, I actually fell asleep.
Right. Acupuncture has been described for so many things. It's an art form and medicine form that originated 5,000 years ago. The first textbook they found was 3,000 years ago, and it's such a well-developed textbook they felt like it was around for several thousand years before. So they figured anything longer than 3,000 years, they roughly settled on 5,000 years ago, acupuncture originated, and it was the only form of medicine. So they had it described for everything, for every type of pain and every type of cosmetic needs and every discomfort and psychological issues. So what I found worked very well in my practice is pain management acupuncture. And pain management acupuncture would be for things like back pain or after surgery or even mental pain, which we call stress. Those are things that I found work very well in acupuncture in my practice. And patients will usually come about once a week. And you usually should notice a good change by 4 sessions. And most patients do about 8 to 10 sessions for a plateau effect when they get to a point where they feel like they've gotten as good as they want to get or as good as we can achieve with acupuncture. After that, we go to perhaps a maintenance phase, or the patients do their own maintenance phase as homework. Like self-massage or go see a massage therapist, and very importantly, physical therapy and exercise.
Is acupuncture beneficial for acute pain as well as chronic pain?
It's especially good for acute pain. In fact, chronic pain is difficult for any form of medicine modality to treat. The longer somebody's had a pain problem, the harder it is to treat. But for some reason, I find that I get a lot of the chronic pain patients in our Modesto practice because I think patients have experienced their pain for so long, they've seen everybody, and acupuncture's on the bottom of their list, which I somehow think acupuncture should be on the top of the list. But being on the bottom of the list, then I end up seeing them 5 years later after the pain started, so it becomes chronic. Acute pain, in fact, when the pain starts within the first 3 days, I think the acupuncture is the most effective. And that's probably true for most any other medical modalities for treating pain or any other illness. If we catch it early, we can do more with medicine.
I noticed when you did the acupuncture on me, I didn't even feel the needles going in, and you said that you use these very small needles. What is the actual size?
So here I brought in the very small needles. My staff had picked these, and these are the smallest needles in the office. I think they're probably a 36 gauge, knowing that I use 32 gauge needles and 33 gauge needles.
I won't touch it, but I just want to look at it.
You can touch that for sure. I have a lot of them.
It's smaller than a
and it's really hard to
sewing
see.
needle.
Yeah, even if I'm looking at it right now, it is.
I can't even see
very
it through the
small.
plastic.
We can put several of these needles into one of those needles that we use to draw blood. You know, you can put about 12 of these into the head of one of those needles.
Yeah.
So that's this small. It's smaller than, I would say it's probably smaller than human hair, possibly.
Well, I have to say it was extremely beneficial and zero pain.
But that's this needle, and then they range in sizes. Then we got pretty big acupuncture needles for patients that might need it for other reasons. So I wouldn't say acupuncture is completely pain-free for everyone.
I have a high pain tolerance, I
Yeah,
guess.
maybe you have a lot of pain tolerance. I heard that you have proven that somehow, if you ever want to talk about that.
Yeah,
But,
over the last week, yeah.
Yeah, I heard. I can't say.
Yeah.
But with these needles, the small ones don't usually hurt much. It is common sense, I think. The smaller ones don't hurt as much. The larger ones hurt more. Why would we need to use larger ones? For patients with like a deeper muscular problem, there's actually acupuncture points that we actually access against the bone, and sometimes we need to use a slightly bigger needle to get down that deep. But that's rare, and if things hurt too much, there's always alternatives in my practice that we can choose other points. This smallest needle is the one that we use the most commonly for auricular, meaning ear acupuncture, so that would go in the ear.
You brought a box of Juvederm.
Yes.
Tell us a little bit about this for about 1 or 2 minutes, and then we're going to go ahead and run that video.
Juvederm is a big part of my practice. Cosmetic surgery is a big part of our practice. I am the Botox and Juvederm and filler injector in our practice with Dr. Tammy Wu. She gave me this job in 2006. I didn't know if I would like it at the time, and now I love doing fillers and cosmetic injections. Juvederm falls into a family of cosmetic injectable implants. They're liquid implants. This can be placed and molded in various places in the face and other places of the body, but FDA approval has this listed as for the parentheses around the mouth. And for that area, most patients use about 1 to 2 syringes of Juvederm. And one of these boxes is usually 2 syringes of Juvederm. And Juvederm fills in the larger and static, meaning it doesn't move when is not present. It doesn't have to require muscles to create the wrinkle. So for static wrinkles and for larger wrinkles, this fills in that space, and that's why we call it fillers. And the great thing about Juvederm is it's also reversible in case we have a problem or a result that we don't like very much. There is a capability using another drug to reverse the effects of Juvederm completely, but not very many people go for that option. So after spending the money on the Juvederm, we usually want the patients to love their results.
We're going to see a clip now of Botox. Tell us a little bit about that and kind of set up the video. It's of you mixing the Botox and then actually doing the procedure.
My staff thought I might need a bottle of Botox. And I was like, why would I need that? And here it is, a bottle of Botox. Yeah, so Botox is a neuromodulator. It changes the way the neurons talk to the muscles. So the neurons would fire off a signal and the muscles respond like a slave. But what Botox does, it lets the muscles kind of be a little bit more relaxed. When the neurons fire, the muscles then say, well, okay, I will do what you say, but I don't have to do it as intensely. So having a less intense response, that causes us to have less wrinkles because of the intense response like I have right here. I need my Botox right now. So that's a very common injected area for Botox. Why? Because being on TV a lot with the bright lights, and we might need sunglasses here, but that is an area that can crease in and become semi-permanent, and Botox can prevent it from becoming semi-permanent, and also would prevent me from looking angry on TV.
We'll go ahead and run that clip now.
So I'm about to make today's Botox batch. At least to get started, this is what I do most mornings. looks like this. Check the expiration date, November 2014. So today is May 21st, 2013, so we have some time to use the Botox. But after we reconstitute it, we usually want to use it within a day. So reconstituting is what we're doing. And I'm just reorganizing my special needles here. These are the needles I use to inject Botox with. What's really special about these is that the plunger goes all the way to the very end. So when we use them, we get every drop out of the syringe. Most regular syringes, the plunger doesn't have that extra tip piece that goes all the way to the end. You end up getting some Botox stuck at the end, and I think patients like to get every drop out of it. So the difference between the two plungers is that this plunger is flat, this one's shaped like a T, and the bottom of the T part pushes all the Botox out. So right now, to mix it, we're going to use the bigger syringe. And if you see any large needles, it's only to mix the syringe, it's not to inject in people. So any of the large needles is just for mixing purposes. I try to mix it behind the patient only because if they see the big needle, they get a little worried. This is that brand new bottle of Botox that I just took out while we're waiting for the alcohol to dry on the tops of these. As we know, alcohol kills germs by drying first.
In terms of why I come to Dr. Lee, I actually come from the Bay Area. I met Dr. Lee when I was living here in Modesto, and just think that, he's very thorough, he takes his time, incredibly knowledgeable, so that's important to me. I tried actually to go to one other place in the Bay Area and actually left before the procedure was done, and just decided I was going to continue to come back here to Dr. Lee.
What procedure are you having done today?
Botox.
Have you been happy with the results that you have encountered so far?
Yeah, no, absolutely. I've probably been getting Botox for about 3 or 4 years, and just think that it's, good preventative as well as, kind of helps with current needs. So.
The Botox comes as a powder, at the very bottom of this. It's very hard to see, and even when I look at it really close on, it almost looks like they gave me an empty bottle, but the Botox is actually right there on the bottom. So I have to reconstitute it with saline. A lot of times patients ask, do you dilute your Botox? But I think what they're actually asking is if I actually dilute it more than I'm supposed to. But I have an actual formula that I use and try to stay consistent to that so that patients get the units that they paid for. So it's not diluted more than they need to, but you do have to reconstitute it, or I guess maybe you want to call the word dilute the powder so that the powder dissolves and becomes injectable. Okay. And in my secret formula, 2.5 cc's of saline goes into one bottle, which is 100 units of Botox. Like that. And I swirl it around gently. And I let it sit for a couple of minutes before using it. I do turn the cap upside down, just in case some of the powder was stuck on top, and I do want to get all of it down into the liquid. But then I let it sit for a while and I put it back in the refrigerator until my first patient is ready. So it's kind of famous like time to make the donuts commercial from a long time ago. It's also nice if you have the syringe and the needles that are kind of cold, so it keeps all the Botox protected. The patients are ready to get their Botox.
That you're going to be performing here is on one of your patients, and we're having the studio turn down the music in the background there so we can hear you kind of give us an explanation of what's
So I
going
can
on.
do a voiceover on the whole procedure here. I
Yes.
see. So there I am getting the Botox ready, making sure my patient's not too nervous and hasn't fainted yet. My patient's very gracious to allow us to use this clip, so I want to thank him very much for this. He actually traveled very far to come have my Botox done here, or his Botox. I guess it's our Botox. We claim the results together. I'm working right now on his glabellar lines. The glabellar complex is a complex of several muscles that creates that frown in the middle that I was demonstrating on my own face. And sometimes we call it the 11s. And I try to customize my Botox injections for each patient. Everybody's got a slightly different configuration to their glabellar complex muscles. And for him, he has a very, very deep furrow in the middle. And also, by being a male patient, he would probably need more than most of the other women patients in the practice. And he has reported to me that he's very happy with the results.
Now, you mentioned earlier about Dr. Wu being in your office as well, and we just saw on the screen there surgical artistry. So
Right.
far, we have talked about Dr. Lee and what it is that you do specifically, but tell me a little bit about surgical artistry.
Surgical artistry was formed initially by my wife, Dr. Tammy Wu, and she started surgical artistry in 2003. In fact, back then it was Tammy Wu, MD Incorporated. And when I decided to join the practice, we wanted to give it a name that kind of wasn't either my name or her name, and I came up with the suggestion of surgical artistry, and we went with that. We're located in Modesto, next to the post office on Sylvan Avenue, and it's just wonderful practicing in an office with my spouse, and perhaps boss. I think that's probably a good way to put it. Her name is on the wall of the building, and I haven't gotten my name on there yet. I'm working on it. Maybe a little more Botox, hopefully. So I've got to earn my place there. So it's very nice having a spouse to work with there. When I was doing trauma surgery, I hardly saw my wife. We had different operating schedules. Trauma was very active at night, and cosmetic surgery is very active during the day, and it was planned that way. And now we see each other every day. We could have lunch together every day, and I think it's wonderful to be able to do that. So I'm very lucky.
Speaking of being partners in life and business, you are also partners in Contentment Health magazine.
Yeah.
Tell us a little bit about this article. Contentment Health is obviously a magazine that is put out, we talked about it before, by Never Boring Design and Associates. And you not only have advertising in all of the magazines, but you also have this huge article on sunblock, which is in 100-degree temperature,
Right.
very important because we sweat it off, don't we?
Contentment Health is an amazing magazine, and I think it's a great magazine that tries to show off the great things about Modesto. When I saw how wonderful the magazine in it, I said I would love to partner with the magazine and have an advertisement in it. And I was fortunate enough, they asked me for some articles to write. And sunblock during the summer, sunscreen is a very important aspect. To summarize this whole article in one word, it's zinc. Zinc is the best ingredient in your sunblock. It blocks UVA and UVB very well. There are other ingredients that are very good too, but if we're looking for number one in my book, it's zinc oxide, zinc. So thank you very much.
And I wanted to hold this up here very quickly because if you are looking through these magazines, this is the advertisement for Dr. Lee and Dr. Wu. So check out Surgical Artistry. They're very personable and very approachable.
Oh yeah, thank you.
Let me have your information on Facebook.
My Facebook information.
Yeah, because don't you have a couple pages on there?
Yeah, I kind of do so many different things. I try to have a separate page for everything, and before you know it, you have 300 different pages, which I actually do have about 300 different pages. But on Facebook, there are two main pages. I have one for myself, which is facebook.com/Modesto, because I love Modesto that much, so it's just /Modesto. The other page I have for our plastic surgery practice is facebook.com/Modesto Plastic Surgery.
Well, that will be easy to remember.
Yeah.
Thank you very much.
Thank you again.
Okay, and we'll look forward to seeing you in your office soon. Maybe I'll come in for some of that pain management.
Okay.